make sure your bed is all the way to your waist level. So you don't need to continue bending your back. Okay? And then you prepare a basin. Okay? And then you prepare a face cloth. Okay, face cloth and towel. You can prepare like 3 to 4 set up the towel and the face cloth. The reason is whenever it gets dirty, you don't need to run it to outside and then grab it and bring it more in. You can just prepare a few sets. Because anyway, you have to changing the towel and the face cloth and the water a few times. When we're gonna change it, after we clean the feet, and before we do a private area, we want to changing water, changing towel, changing face cloth, because we don't want to be cross-contaminated, because feet is really dirty, have a lot of fungus, and private area should be more clean. Got it? So, and then you also can prepare 1 blanket to cover the client during the procedure. If a client feeling cold, if a client saying, no, I'm not really feeling cold, then you can just removing that top sheet, you keep this bottom sheet. You don't want to keep 2 sheets because it's not convenience. Like you keep turning client, there's 2 sheets, not convenient. So 1 sheet is the best. Depending like client feeling cold, not feeling cold. If the client not feeling cold, you can just keep the bottom sheet. If the client feeling cold, you keep that the blanket. You cover the blanket and you remove both that. Okay. Now I assume the client is hot. I think she's hot because like this. Then you can just remove this one. Okay? You can just remove this one. Okay? And then you keep this one to cover the client during the whole procedure. And remember, this time the client's already removed the gown. So you don't want to expose the client's body to anyone. Okay? So now you prepare the basin with the water. Okay, you prepare the basin with the water, and then there's 2 options. One, you put the soap into the water, and then it's a little bit soapy water. Okay, for the elderly client, usually it's too dry, so we don't really recommend it. Okay, if you put the soap into the water, you need to prepare other basin to rinse the soap out, remove the soap. So you need to prepare 2 basins. Okay, for young people like you and me, we should prepare 2 basins because we're sweating, we have a lot of oil, right? So it's more dirty. So you need a soap. But for elderly, okay, like 80, 90, they don't sweating, they don't have oil gland producing too much oil. So you don't need that kind of like soapy. If you want to add a little bit of soap on it, you can do like this. You can using a face cloth. You need to dip inside in the water, okay, and then you take out, you squeeze out the water, you put a little bit of soap in here, you just like wrap it like this, then they become a little bit soapy. Then you can use to clean the client, and after that you're using other towel to remove the soap. Then we don't need the 2 basins, just need 1 basin, and the basin should be on the overbed table. Okay. So now I'm going to start the procedure right now. So I'm going to begin with the head, and then the arm, and then the chest, and then the feet, and then the back, and then the private area. So let's do with the what? The face first. We're going to ask the client to lift up the head, and then I put the towel underneath the client. Okay? So, and then the first technique I'm going to teach you is how to make a face cloth. Okay, eye. Yeah, do the eye.